Hello, and welcome to episode 31 of the Cancer Pod. Today we're talking about vitamin C, insufficiency, deficiencies, how it's relevant to cancer care, all this and more on today's episode.
I'm Dr. Tina Kaiser, and as Leah likes to say, I'm the sciencey one.
And I'm Dr. Leah Sherman, and I'm the Cancer Insider.
And we're two naturopathic doctors who practice integrative cancer care.
But we're not your doctors.
This is for education, entertainment, and informational purposes only.
Do not apply any of this information without first speaking to your doctor.
The views and opinions expressed on this podcast by the hosts and their guests are solely their own.
Welcome to the Cancer Pod. How you doing, Tina?
I'm doing. That's all that counts.
This is now our fourth time?
I don't know. I lost track. Fourth time, fifth time. I'm not sure how many times we've already done half of this podcast.
Yeah, we can't seem to get to the other half, and we keep losing our recordings. So let's just start from the beginning.
It's a very good place to start.
So Tina, higher primates, guinea pigs, and fruit bats. What do they have in common?
Well, trying to make this sound fresh.
You've never heard me ask you that question before.
I know the answer. None of them can make vitamin C.
Exactly. They all have to get it through their diet. And it's an essential nutrient that is used in so many enzymatic reactions. It's used in pretty much every tissue in our body. So it's really important to make sure that you do get it in your diet. And that's why we are talking about vitamin C today.
Yeah. And it does have quite a bit of research around cancer care too. And so we'll get into that.
Yeah. So we will start covering, like we usually do, the guidelines for taking a supplement. So does it help with an acute deficiency? What does it do if there's a chronic deficiency? And then also green pharmacy, which is when it's used at different doses to address a specific purpose. So I'm guessing most people have heard of scurvy for one reason or other, if not for the legend of British sailors having Lyme to prevent their scurvy.
Yeah, I think that some people know that story about how limes were taken on board to prevent scurvy, and that was credited to James Lind.
He was a British Navy surgeon who had noticed that when people had citrus fruits or juice, that the symptoms of scurvy improved.
Yes, not for the reasons he thought. He, like many physicians of his day, thought scurvy was due to putrefaction of food within the body. And so he set up a little experiment and said, if that's the case, then acidic food should improve things. And he had 5 different groups. Each group took a different item. Some of them took sulfuric acid. Some of them took oranges and lemons. Some of them took seawater.
That's a good one.
In any case, of the 5 different arms in this first of its kind clinical trial at sea, he found that only the group who took oranges and lemons were saved from having scurvy. The other groups went on to have scurvy, and some of them actually died of scurvy.
Because he gave them seawater.
Well, that didn't help for sure. But I thought one interesting little factoid in this whole story of his being credited with this. One, he didn't invent it. He just happened to set up an experiment that was rather convincing once we knew what was going on. In its day, it wasn't convincing, despite the fact that he wrote an essay on it in 1753, a treatise of the scurvy. In any case, nobody gave much love for this whole thing until much, much later. He himself never embraced the idea that the citrus contained something that reversed scurvy because he continued to believe that it was putrefaction of food. He didn't really advocate for citrus as a single solution for scurvy, even though it was.
But I wonder if he used the citrus on patients with this alleged putrefaction that wasn't actually scurvy, and if it just didn't work.
Right. Sure.
You know?
Yeah. That's totally possible. Whatever it is, he couldn't let go of that kind of dominant paradigm in his brain. So for that reason, he never fully appreciated it in his lifetime. And it wasn't until we looked back and found out what was in the citrus that we also appreciated. But so we're clear, he didn't come up with the idea of putting citrus on the boats. That had been done for hundreds of years prior to him.
But he got the credit.
Yeah, he wrote about it, and yes, he went down in history as the person synonymous with this as a remedy, even though I think it was a traditional medicine. But I think he's just as famous for doing what they consider one of maybe the first trial in humans, the first kind of trial of 5 different arms, taking 5 different things and proving which one worked.
Interesting. So, but ultimately, ascorbic acid or vitamin C wasn't even discovered until 1932. So it was this idea that citrus fruit could help eliminate the symptoms, but they didn't know what it was particularly in it that was, the cure.
Right. They did not know the compound, which goes along with so many times that this happens, right? I mean, we often find that some food contains an item, an essential nutrient that cures fill in the blank, so B12 deficiencies were cured with foods before we knew what B12 was. In this case, it happens to be vitamin C. But that happened over and over again where, they used food to prevent overt deficiencies of a nutrient, but they didn't know the nutrient chemically. They didn't identify it. They just knew that eating the food prevented it. Another example of this is adding lime to corn flour in many traditions. And what that did was it made the vitamin B3 more available and spared people vitamin B3 deficiency or pellagra.
Nixtamalization. That's what that's known as.
Nixtamalization is adding the lime?
Mm-hmm. Yeah, you'll notice that if you buy like corn tortillas and stuff.
Mm-hmm.
That's the kind you want.
It's not just to make them delicious.
No, it does soften the corn.
And it makes the corn's vitamin B3 available too.
That's awesome.
Yeah. So anyways, a lot of these things that we do with traditional foods and in cultures around the world was done to prevent disease states or prevent deficiencies of nutrients unwittingly. Had no idea that's why we were doing it, at least consciously.
Okay, so from looking at the side effects of scurvy, you can kind of see all of the effects that vitamin C has on the body.
Mm-hmm.
Fatigue is a big one, and that may have to do with the role of carnitine, which helps with heart function.
Mm-hmm.
And so carnitine is vitamin C dependent. Inflamed gums, joint pain, poor wound healing, thickened skin, corkscrew hairs, iron deficiency anemia, bruising, like these little tiny bruises known as petechiae. And then eventually there was impaired collagen synthesis and weak connective tissues. So it just shows you how prevalent the need for vitamin C is in our bodies.
Yeah. And I think that it's essential for collagen to be produced in our bodies. And for those who didn't hear this in our last episode, which focused on collagen makes up 30% of the protein in the human body. It's the major structural protein. It creates almost like a scaffolding. It helps the structure of all of our tissue. Most people think about it for skin, but it's everywhere. And there's 28 different collagens, and we talked about that in detail. But vitamin C is needed for making collagen throughout the body. So you could see how it has global effects if you don't have enough vitamin C. If you can't make collagen, a lot of things will break down.
Yeah, and scurvy can be fatal. So severe vitamin C deficiency is fatal. We don't really see that so much, at least in the US. It can happen in certain areas where there might be lack of access to foods, fresh foods, because vitamin C is volatile. So if you're buying, canned fruits, they may not have the vitamin C content. Mm-hmm. Through their depending on what their processing is. The elderly, people with restrictive diets, malabsorption, people with kidney disease.
Yeah, the irony of that one is they did a lot of trials on those with kidney disease, severe kidney disease. They gave them vitamin C, and that definitely helps improve function. So there might be a little bit more requisite, a little bit higher requisite for those who have severe kidney diseases. And by that, I mean kidney failure stages 2, 3, and beyond.
Right. Another group of people who might need higher doses would be smokers and passive smokers, as well as women who are pregnant or breastfeeding. And then another group that would be potentially deficient in vitamin C would be infants who are fed boiled or evaporated milk.
Interesting.
Which I've never heard. Well, I guess, if you heat breast milk, but you don't bring it to a boil. So I don't know much about what what infants eat.
Yeah, and well, that whole heat will break down vitamin C pretty quickly.
Mhm.
So vitamin C you often hear about in fruits or in berries or things that we eat raw, peppers. That's where you hear about getting vitamin C because once you cook it down, like you're eating a soup where there was a bunch of vegetables that had it when they were raw, it's going to be broken down
Oh, because of the heat.
because of the heat. Yeah, it's pretty fragile in the grand scheme of molecules.
So the recommended dose for vitamin C, it is pretty low. WHO recommends about 45 milligrams, which is like maybe like a really small, like one of those cutie oranges or something. It's like or half an orange.
Mm-hmm.
The FDA says about 60 milligrams. And then Linus Pauling Institute, which is where I got a lot of my notes from, they recommend about 75 milligrams for non-breastfeeding, non-pregnant women and 90 milligrams for men. And then smokers would be about 30 milligrams higher for each. So that really comes to like, at the very most 100 to 125 milligrams of vitamin C, which is easily obtained through the diet.
Yeah, and because the requisite amount of vitamin C can be easily acquired from the diet, that means we don't see it where people are well fed as much as we will see it where people have no access to fresh fruit and vegetables or no access to, good food in general, right? So this becomes a bigger problem around the world than we have in our kind of well-fed societies in the West. So we don't see scurvy per se in the United States very often, but we probably see more of the effects of when people don't eat fresh fruit and vegetables, when they don't get enough vitamin C to maintain adequacy over a long period of time. So that shows up as cardiovascular disease. That means specifically endothelial dysfunction, which means the vasculature itself suffers. Gums and teeth. So there'll be effects on the enamel and the gums. The mouth will show some inflammation sometimes, so maybe some gingivitis. There can be effects on neurotransmitters over time. The effects are more subtle.
It's more like insufficiency, right? It's more like chronic insufficiency because they're getting enough to not have overt deficiency like scurvy, but they're just not getting enough to reduce their risk of other things. We see that with poor wound healing a lot too.
Mm-hmm. Mm-hmm.
Because as we discussed in our last episode, you need that vitamin C for collagen. It's what helps with that structure. It can affect the eyes. There's some information showing that cataracts or macular degeneration may be reduced. The risk of that may be reduced with vitamin C foods, maybe diabetes, Alzheimer's. It's really hard because a lot of these studies will show benefit, and then there'll be studies that don't show benefit. So,
and that goes back to how the study was designed, whether these people had an actual need for that nutrient or not. So that's often the case in those studies that are conflicting is the designs are different. So on that note, I don't think we mentioned the one thing that most people associate vitamin C with, and that is it's an antioxidant as well. Did we mention that?
Nope. No, I don't even think we mentioned that the first 4 times we recorded it. I don't think we got that far.
Well, in its role to protect the eyes or protect the vasculature or cells throughout the body, or even in those smokers, the reason there's a higher need of vitamin C is an antioxidant, and it plays a role in antioxidant enzyme systems within the cells. So it helps alongside things like vitamin E to perpetuate kind of an antioxidant effect within cells. So it prevents damage, long story short. Damage due to pollution, damage due to high sugar diets, damage due to aging itself. I mean, there's just damage that happens to cells as just a matter of course of living, right? So vitamin C has global effects in so many ways.
It's the anti-aging vitamin.
Ooh, did you just make that up or did you
I just made that up. Yeah, I'm going to hashtag market copyright. So that kind of leads us to the green pharmacy use of vitamin C, which, as I mentioned, it's something that I do recommend for my patients a couple weeks leading up to surgeries, as well as continuing it after surgeries during the healing period, because it does support with scar formation and healing and all of that.
Mm-hmm.
I think people mostly know it for cold prevention, right? I mean, the products like Airborne or Emergency, you always hear someone saying like, oh, I'm getting a little tickle in my throat, I'm going to take some Airborne, or I'm going on a plane. That's the whole reason Airborne came about. And again, the information that's out there, does it really show benefit? I don't know. know.
Yeah, it does seem to increase some of the white blood cells that we need to fight off infections. And it's like so many of these nutrients, we can say for sure that a deficiency or insufficiency does you no good. So I think that's like making sure that you have enough for proper function is good when a green pharmacy, or what we call green pharmacy, a mega dose, a specific dose, a larger dose than you would get from food, when that's indicated is always up for debate and may vary by doctors' opinions. The other thing I use it in larger amounts for is to goad people's bowels.
To goad?
Goad
To
them
taunt?
along.
I use
No,
it to taunt their bowels.
goad them along. No, for constipation.
Hmm.
Yeah. So the classic term is taking vitamin C to bowel tolerance, and bowel tolerance is literal. It's as much as your bowels can tolerate. So, in other words, once you hit bowel tolerance, your stools get loose and it loosens up the stool. So, if you're constipated, that can be useful. And bowel tolerance is the maximum amount you can absorb. So, some people can absorb 2 or 4 grams, and other people can absorb 8 or 12 grams in a day. And so finding that and using it to loosen the stool can be helpful for some people.
And I guess that kind of brings us to like the doses that you can get in supplements. It's typically a 500 or 1,000 milligram capsule or tablet. For wound healing, I usually have patients take between 1,000 and 2,000 a day, and I try to make sure they're including all the foods as well.
Mm-hmm.
But knowing that, like 125 milligrams is really like what is recommended as the RDA, the recommended daily allowance, like even 500 is a really high dose. And so it's interesting because your body can only utilize so much.
Right.
And so taking 1,000 milligrams at once may not even be beneficial.
Yeah, the question I think that we don't know the answer to, that I have never seen an adequate answer to, is what the rest of that vitamin C does. So let's just say you take 1,000 milligrams and you absorb half of that into your bloodstream, and the other 500 milligrams, wends its way through your small intestine and into your colon, how that affects the gut bacteria. But I don't know what it does down the line. I think when we use something traditionally and we notice an effect, sometimes we don't know why it's happening. In other words, like vitamin C up to bowel tolerance, maybe the leftover vitamin C that's floating down the colon actually has a physiological effect as well as the C that's making it into your bloodstream. I don't know.
Yeah. I mean, and thinking back to the people who are at risk of low vitamin C, I mentioned malabsorption, I think. I think I mentioned malabsorption, but I think about people who have had surgeries where they've had parts of the upper small intestine removed, and that's where you absorb your vitamins. And so those people might be at a higher need, and their bowel tolerance may be lower. And bowel tolerance it's something that I learned in school, but it's not really something that I use.
Mm-hmm.
It was kind of, I want to say it was a trend for a while. Maybe it still is in some circles, but I don't really see it used that much.
Yeah, I think that it was definitely more popular, 15 years ago than it is now, for sure. Now people turn to liposomal vitamin C.
Yeah.
So liposomal vitamin C is specially packaged so that you can absorb more of it in your small intestine.
Yeah, I've never recommended it for patients. I know that it is easier for patients to tolerate, as well as buffered. Sometimes it can be buffered with minerals.
Mm-hmm.
It can be upsetting to the digestive system.
Mm-hmm.
So, but I do have patients that I have seen come in and they're like, oh, I'm taking this liposomal vitamin C. And I'm always like, okay. Vitamin C itself is really cheap. And so when you get into something like liposomal, it is more expensive.
Yeah. And I feel like it is absorbed pretty well. And those liposomes are being used for other molecules out there too. Quercetin, resveratrol, curcumin. You can find liposomal, fill in the blank. It does appear that liposomal vitamin C leads to higher blood circulating levels of ascorbic acid, right? So there is higher levels of vitamin C in circulation than there is when you take just vitamin C as whatever, magnesium ascorbate, potassium ascorbate, calcium ascorbate, whatever, orally. So it's a little bit more than you can get from any good old vitamin C over the counter. It's a very different than if someone is doing intravenous vitamin C at higher doses. And so we're going to talk about that, I know, in a little bit, but I just wanted to put that out there now because we're mentioning liposomal. And I have had people come to me and say, well, I heard liposomal can also give me these large doses of vitamin C. And it's higher than oral. It's nowhere near as high as what people can do if they get IV vitamin C.
And IV vitamin C, as we will discuss, is a completely different mechanism from the antioxidant action of oral vitamin C.
We can even say it's the opposite.
We don't want to give away too much.
All right.
I do want to mention, because I think this is really cool, is that vitamin C is important to make neurotransmitters. So at times when you're really stressed, I know when I get really stressed out, I reach for like either some sweet foods, like some bittersweet dark chocolate. That's as sweet as I get. Or I reach for crunchy, salty foods. But, knowing that vitamin C is important, perhaps I need to reach for strawberries or blueberries and the like.
Mm-hmm. Yeah, that's a good point. Yeah.
Because as we say with pretty much all of these Supplements 101 episodes, it's food first.
Yeah. Yeah. And generally, vitamin C is not something you have to take a supplement of to get adequate amounts. You can totally get adequate amounts from food and find foods that you enjoy and favor those foods. It's in so many different fruits and vegetables.
So let's take a break and then we'll come back. We will address the oral versus IV vitamin C and just talk about a few more uses.
Okay. See you on the other side.
Citrus fruits have the reputation of being high in vitamin C, but other fruits and vegetables contain as much, if not more, of this essential vitamin. Guavas, kiwi fruit, red bell peppers, strawberries, papaya, broccoli, and other brassicas are all rich in vitamin C.
So we're back. And what I was thinking with other uses of vitamin C is you see a lot of beauty products where there's this topical application with serums and whatnot. And I wonder, with the volatility of vitamin C in general, how beneficial are those products?
Yeah, that's a good question. Yeah, I don't know. I mean, I always wonder how vitamin C, makes it, how it doesn't get degraded, oxidized in the bottle itself.
There was a doctor that I worked with whose wife was an esthetician, and he would buy bottles of vitamin C capsules and she would use them, like mix it with some sort of gentle face cream, open each capsule, put some in, and then apply that. And apparently that's not a bad way of doing it because there's no time for it to break down. Whether it actually, has the same effect as these highly processed vitamin C serums, who knows?
Mm-hmm.
If anyone wants to send us some highly processed, very expensive vitamin C serums, we could try them out and see how they work.
I'll go so far as just put on half of my face and let you see what happens.
Yeah, no, I'm going to put it on my whole face. But maybe I'll try the capsules. I bought some capsules with that intent, and I think I ended up taking them. So orally.
Well, you got to only put on half your face. How would you know if it's working or not?
Oh, I'll know.
Oh, you think so, huh?
Oh, I'll know.
You've got very good
friends. With half a youthful face.
I was going to say you have very close friends that'll tell you the truth, maybe.
I have my own eyes. Anyways, okay, so I'm just trying to think if there's any other use with vitamin C. And at this point, my brain is shutting down. So let's talk about the role of vitamin C, the role it plays in various cancers.
Yeah, I think the two areas that are of most concern, at least in the Western world, cardiovascular disease and cancer. And I think vitamin C is prominent in each of them. So we mentioned cardiovascular disease, and that's everything from stroke and hypertension to atherosclerosis. I mean, vitamin C is preventative across the board for cardiovascular diseases. In cancer, we have a lot of observational studies. We don't have a lot of interventional studies. So the problem with this is vitamin C is gotten from food, and those foods are complex, right? So you're eating fruits and vegetables. Well, higher fruit and vegetable intake is already associated with lowering the risk of various cancers. So they did look at studies, and from what it looks like, higher levels are better. And by higher levels, you're talking about a couple hundred milligrams a day versus 30 milligrams a day. And this is from food again. So there's a lot more going in anyone's mouth when they eat the fruit. They're getting all these good phytochemicals. They're getting polyphenols and bioflavonoids and all this good stuff going in that we know has, benefits and can lower the risk of various cancers. That said, the research, at least, if we're going to just be research intensive about this, is strongest, or we have the most data on breast, stomach, colorectal cancer, and non-Hodgkin's lymphoma. And each of those, they're all found on the Linus Pauling website, they did a nice job of summarizing the data on each of those to date in humans. And like I said, most of this is observational, right? You're watching a population of people over time and you're making determinations about trends in the data, so adequate and higher intakes of vitamin C through food was associated with lowering the risk of various cancers. One study, I remember this years ago, that wasn't just a population study. They actually looked at the tissue they had removed from people who had their colon resected. So they had colon cancer, they had surgery to remove the tumor. They looked at the amount of vitamin C in the tissue itself in this study. And then they watched people over time. And those who had the highest vitamin C in the tissue at the time of surgery had much lower rates of recurrence over the next 5 years.
Interesting.
Yeah. Yeah. I mean, that was the most profound study for me to kind of think about in my practice, because I'm usually seeing people once they have cancer. So as much as I'm, an advocate for reducing risk in every way, shape, and form, by the time I'm seeing people, they already have a cancer diagnosis. So the question is, how do we make it so we reduce your risk of recurrence? And, making sure your vitamin C intake is adequate seems kind of an easy, inexpensive, why not kind of thing to put on a list of to-dos.
And I don't want to discourage people from eating cooked vegetables. They're actually, I found this really interesting article about a young girl who was a freshman in high school. And for her science fair, she looked at how much vitamin C is in cooked versus raw green bell peppers. I guess she liked cooked bell peppers, but didn't like raw. And the article mentions that about 1 cup of green bell peppers have 129 milligrams of vitamin C. And so she prepared the green peppers and she weighed them, and some were fresh. And then she put some in boiling water for 10 minutes. Another was for 20 minutes. And then the last one was for 30 minutes. And she kind of separated the solid bits out. And then she tested the liquid using a vitamin C test kit that she purchased. And she used the pepper juice in the testing kit to see how much concentration of vitamin C was in each pepper. And the raw peppers did have the most vitamin C, as to be expected. And the 10 minutes of boiling showed the peppers had about 25% less vitamin C. But when the peppers were boiled for 20 or 30 minutes, the vitamin C level came up again. And the thought was it was because as the peppers lose water, the vitamin C starts to be concentrated more in the pepper.
Ah, I see what you're saying. So the concentration goes up of the fluid.
Like from the juice of the pepper. Yeah. So, I mean, you're still getting vitamin C if you're cooking your peppers. If you don't like raw peppers and you want cooked peppers, there still is vitamin C in there. You just have to eat more of it.
Okay, sure. Yeah.
Because some people can't digest raw vegetables well. So I do want people to know that you can, and there are other nutrients. Cooking, dark leafy greens is how you get certain nutrients from them that you might not get from raw. So eating a mix of raw and cooked vegetables, I think, is important for people to realize it's not one or the other. If you don't like raw bell peppers, you can have them cooked.
Right. Sure. Yeah.
And I don't know if I would cook bell peppers necessarily for 30 minutes. I think they would get really gross by then. And I think she even commented in the article that, it smelled bad. But it is like we mentioned in previous episodes, cooking those green vegetables until they turn bright and not until they turn gray.
Totally agree. Yes. A mixture of raw and cooked vegetables is your best bet for sure.
Okay. So this is a really big one. People want to know about IV vitamin C. We're not going to delve into it. We're just going to kind of touch on it. But that's a big question. And we do have patients taking high doses of liposomal or other types of vitamin C, thinking they can achieve the same effect as IV.
Yes. And so there is more and more information on the use of higher doses of intravenous vitamin C. And by high doses, we're talking high, 10 grams intravenously. So directly into the vein is still not considered a high dose in the world of people who do IV vitamin C.
And that's what Linus Pauling had studied. He had studied 10 grams a day IV, and he did it for 10 days, followed by at least 10 grams a day of oral vitamin C, and that was to be repeated forever.
Yeah, and those were fairly advanced patients, and he showed that people fared better and they felt better was a big part of that too.
as we mentioned, the action, the mechanism of action of IV vitamin C is not the same as oral vitamin C.
You're right. The intravenous vitamin C, once you give it over 10 grams, certainly, is no longer an antioxidant. It's not an antioxidant in any way, shape, or form. It is a pro-oxidant. It's actually causing more oxidation within the tissue itself. So there's an enzyme called catalase that's found throughout the body, and catalase breaks down hydrogen peroxide. And normally, there's that if your body has hydrogen peroxide around the cells, catalase comes along, breaks it down basically into water and a little oxygen. No big deal. Tumors have a hard time with that. This is one of the reasons that people give high dose vitamin C intravenously. Hydrogen peroxide in and around the tumor bed builds up and causes more oxidative pressure, kind of stresses the cells out because those tissues do not break down the hydrogen peroxide as readily as normal tissue does. Now, the other thing that happens with IV vitamin C has to do with hypoxia inducible factor, HIF. And this is a whole nother pathway that I'm not going to get into because it's a little too much for our podcast, but maybe we'll do a larger lesson on IV vitamin C at some point that's more of a visual, because I think we need visuals for this discussion. But suffice to say, the idea here is that IV vitamin C lowers the stimulation of new blood vessel growth in and around a tumor. So those are the reasons. The other is that hydrogen peroxide has some antimicrobial effects. So maybe if there's a tendency towards infections or there's some low counts or there's a high risk of infection in someone, the high dose vitamin C could be used for that as well. But when we have studies using high dose IV vitamin C, it's generally done alongside another oxidative therapy. So like right alongside radiation at the same time. But it's IV vitamin C. It is about the polar opposite of taking oral vitamin C because now we're giving in a large dose. It's causing oxidation in the tissue. It is no longer acting as an antioxidant. It does it for a very short amount of time too. IV vitamin C doesn't have a lasting effect. You hit these giant amounts of vitamin C in the tissue for a couple hours after you receive it, and then it comes back down because your body gets rid of the excess. So that's the short story.
Yeah, and I remember when I was down in Arizona, there was a multi-center trial going on looking at patients with pancreatic cancer, and I think they were receiving the chemotherapy regimen FOLFIRINOX and maybe something else. Maybe it was gemcitabine, I don't remember, and concurrent IV vitamin C. And so that was really interesting that this was happening at, I believe it was like University of Arizona, maybe Mayo. I can't remember all of the centers that were conducting this trial. So like you said, it was concurrent with other treatments. But yeah, we don't want to go too much into IV vitamin C because we're just talking more about vitamin C as a supplement, not as a treatment or concurrent treatment.
Right.
So, okay, let's take another break and then we'll come back and we'll talk about potential interactions, contraindications, and oral vitamin C. Can you do it with your cancer treatment?
All right, let's do that next.
According to some animal studies, vitamin C should not be taken alongside proteasome inhibitors. That's drugs like bortezomib, better known as Velcade, often used in multiple myeloma and some lymphomas.
Okay, so safety concerns and interactions. We have talked about what happens if you don't get enough vitamin C. We briefly touched on what if you get too much, which would be diarrhea. But what else can happen if somebody gets too much vitamin C? And the concern that besides diarrhea that I have seen and heard is kidney stones.
Mm-hmm. Yeah, I think most of that has been seen in people with kidney disease, first of all. So they have trouble with the filtration of the kidneys already. So they have a pre-existing condition. And I believe it was mostly intravenously done. It was mostly intravenously given when they did have incidences.
Another thing that I looked up, what I thought was interesting, rebound scurvy.
I've never even heard of it. Rebound scurvy.
Which is when you get the symptoms of scurvy after you stop taking high dose of oral vitamin C.
Oh, okay.
I've never, this was just something that was in my resource that I looked up. It's possible to get a B12 deficiency. And then there's also high doses of vitamin C can erode your dental enamel. And I'm guessing maybe that's if you're like sucking on a tablet or having it soaking in your mouth.
Sure.
I don't know if you would get that from a capsule. I think it would have to be contact directly with the enamel.
I think you're right.
Yeah. And then the upper intake, like the limit that you will read mostly, is about 2,000 milligrams.
Yeah, I don't understand the upper limit in that it's not harmful after that. Most likely, it's just a matter of you're not going to get much more into your bloodstream after that.
Yeah. And the things that I think our patients and maybe our listeners need to be familiar with is that taking vitamin C around certain labs can affect the labs themselves.
Mm-hmm.
So looking at bilirubin and creatinine in the serum can be affected. And those are labs that are common with cancer patients. And then also the guaiac test, looking for blood in the stool, that can also be affected by taking vitamin C.
Yep, can give a false positive if you took vitamin C and then you get a guaiac test.
And then there are drug interactions. And, I think we've mentioned this before. Sometimes drug interactions are because the drug can deplete a nutrient. And then other times it's because the supplement or nutrient can affect how the drug works. So things like aspirin and nonsteroidal anti-inflammatory drugs, NSAIDs, those can lower vitamin C levels, and also high doses of taking vitamin C. And again, if 2,000 is considered like a high dose, this may be the level that can affect drugs. I don't know. I think it's pretty individual. But high doses of vitamin C can also cause aspirin and NSAIDs to hang out longer, raising that effect, the pain relieving effect in your blood. Whether or not that's a good or bad thing, check with your doctor. And then there's something about how vitamin C may actually help protect against the stomach upset from taking those drugs, because they can really be irritating on the gut. And so vitamin C may help with that. Again, I don't know the doses. That's not why we're here. We're just giving you information.
All right.
Also, there are drugs like phenobarbital, different, barbiturates that can also decrease the effects of vitamin C. And then there are the concerns where vitamin C itself may increase certain drugs. So there are like antacids like Maalox or Gaviscon, which are aluminum containing antacids. Vitamin C can increase the amount that your body absorbs of the aluminum itself. There is a potential for interaction with things like nitroglycerin, the protease inhibitors, the drugs that are used. There's one drug in particular that's used for HIV, indinavir. Vitamin C may, I think it's about 1 gram, 1,000 milligrams, may potentially lower levels of that drug. There are some antibiotics. There are blood thinners like Coumadin, warfarin. You could pretty much put Coumadin on every list for interactions. That and aspirin, those two are like, those will interact with everything. And then there's the kind of like the conflicting information where oral contraception and hormone replacement can not only decrease the effects of vitamin C, but then also vitamin C may interact with those medications as well.
Right. Okay.
So that's the pharmacology part, other than the cancer treatments, right?
Yeah.
So as it does have this antioxidant action, there is potential for vitamin C to interact with chemotherapies or, radiation where you want that pro-oxidant action.
Right. I think of vitamin C as a fairly weak compound when it comes to its antioxidant action in that sense of radiation or chemotherapy compared to, for example, resveratrol or quercetin or, these polyphenols that actually go into cells, cause the cell to actually produce more glutathione. And that is a powerful molecule throughout the cell that is an antioxidant. Like I think of those kind of as heavy hitters and vitamin C as kind of a minor player.
And then you're also saying it's not going to achieve this high state in your blood. I mean, it just kind of reaches a certain level and then it's a steady state.
Oral vitamin C is never going to get very high.
Right. So I know some people are told not to do certain antioxidant foods during treatment. I don't know if they're told not to do vitamin C foods. I have had patients told not to do blueberries during radiation.
Oh, wow.
Yeah.
Well, that's out of an abundance of concern, right? Because that's not evidence-based necessarily.
And it's been more than one patient in more than one city or location. It's such an interesting thing. So yeah, I don't know if taking a 500 milligram tablet of vitamin C daily is something that I would discourage someone from taking. I think it really is dependent on, in my situation, working in hospitals, just making sure that oncologists are comfortable with that.
Mm-hmm. Yeah, I think we're talking about, a garden hose and a forest fire in some of these cases, right? Like I don't think vitamin C is going to undo radiation, for example, or some of the more oxidative chemotherapies. It's really just doesn't have it behind it. It's not, that one little tiny molecule is not going to do all that. Just judging by what it can do, independent of chemo and radiation. So my thought is it's the least of your worries in the grand scheme.
And I do stop it for certain reasons. If somebody is taking a high dose, if there is potential for things like diarrhea, just anything where someone can point to it and be like, well, they're taking this.
Right. Well, yeah, I mean, sometimes you remove things because it gives everyone peace of mind, not because there's really any kind of risk, but just because it's easier to take it out than keep it in for peace of mind for everybody. And if the patient needs that in particular, I would say we just remove it. Most of the times that's what I do for peace of mind. If they're medical oncologist, radiation oncologist, or whomever doesn't like the idea of vitamin C going in, then I'm like, okay, fine, just give it the vitamin C. I don't think it's a big enough player either way. It's not doing anything that I would defend in that sense.
But at the same time, I wouldn't have somebody do some really high dose of liposomal. I'm good with someone doing just low doses, but I'd rather them actually just eat the food, because again, going through treatment, you have far more nutritional needs than just one specific vitamin. And so get it from your food. It's got your fiber, it's got all your other nutrients that you need, your bioflavonoids, blah, blah, blah.
Yep, totally.
Okay. So the last thing would be are there people who should avoid high doses of vitamin C? And for sure, I mean, we touched on people with kidney disease. There are some conditions that are genetic, like hemochromatosis, which is a buildup of iron throughout your body. And we briefly touched on vitamin C being helpful did we even touch on it? I can't remember if we talked about it this time. Vitamin C can be helpful for the absorption of iron, especially non-animal sources of iron. Mm-hmm. And so if you have this genetic tendency to store iron, high doses of vitamin C and vitamin C foods can increase that.
Exactly. Yeah. So if you want to absorb iron and you're taking an iron supplement, vitamin C can be useful for that. But if you're someone who has too much iron, then you don't want to be doing vitamin C alongside foods that are high in iron.
And then the last thing is the glucose 6-phosphate dehydrogenase deficiency, the G6PD deficiency, which is when people get IV vitamin C, they are checked for that beforehand.
Mm-hmm, mm-hmm. Yes.
Don't know if taking oral vitamin C is affected by that. I only know it as for people getting IV.
I've only tested it for people getting IV. I think that overwhelms it and can lead to a hemolytic anemia if they don't have a proper enzyme function. But orally, I don't think it's either here nor there. I don't think you need to know.
Okay. So anything else?
No, I think we actually covered it. I mean, this was take 5, take 6. I don't know. We've been here for hours. So
it's been 5 hours. I mean, I remember the last time I called it, I was like, it's 1:25 and we're starting again. Yeah, no, this has been quite the day. But so this has been our presentation on vitamin C.
We did it.
We did it. Where's that cheering again?
Well, it's not really done until we hear this recording, safely tucked away in our vault of audio, really.
I think I need to hear the applause.
Oh, wait, let me find the applause button. One moment, please.
All right, so let's wrap things up because I think we're both done. Remember to subscribe to the podcast and to share with your friends. We are on Instagram, Facebook. We're on the social media. We have a newsletter. Please go to our website and sign up, and you too can receive the newsletter whenever it comes out again. And consider buying us a coffee, support the show. The link is in the show notes. And it can help us hire someone to deal with all of this technology stuff that is really, really beyond what we want to be doing. We just really want to be focusing on content to give to you.
Yeah. So if you can drop a review, especially if you're on some, Apple Podcasts or Spotify or wherever, that you can put a little note, let other people know, and get them to click the button, like us. And that way we'll get the word out. We really want to just help more people as time goes on, and we're looking for a little snowball effect. So those of you who are subscribed, thank you. That's much appreciated, because I can see the numbers growing in the background, and I do appreciate it. And I know where you are at. I don't know who you are, but I know where you are, or thereabouts.
And maybe next time we will read some of our feedback that we've gotten. We'll read something from all of you.
I think that's a great idea.
Okay. So on that note, I'm Dr. Leah Sherman.
And I'm Dr. Tina Kaiser.
And this is the Cancer Pod.
Until next time.
Thanks for listening to the Cancer Pod. Remember to subscribe, review, and rate us wherever you get your podcasts. Follow us on social media for updates. And as always, this is not medical advice. These are our opinions. Talk to your doctor before changing anything related to your treatment plan. The Cancer Pod is hosted by me, Dr. Leah Sherman, and by Dr. Tina Kaiser. Music is by Kevin MacLeod. See you next time.
Hey, Leah.
Shut this fucker down.
Let's do this.